Welcome to another episode of Weight Loss with Dr. A.
Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to another episode of Weight Loss with Dr. A. And today I want to give you a little bit more information on a certain subject that we get asked a lot. Number one is why Mexico? Why Mexico? The other thing is medical tourism. So explain a little bit about the term and something that we've been doing for over 12 years and how this works. So why Mexico? It's because we're here and the idea is to offer you, the patient, the very best optimal surgery, like in the States, like if you were at home, even better than that, with the same material used in major cities in the United States, Houston, LA, New York. Here, same material, and of course, offer you a better price. The way we do this and how can we offer you a better price is quite simple. Prices in Mexico and the way the hospital bills they function is quite simple. When you go to the States and you get, I'll give you an example, a gauze, or they need to use a certain tape, a wound tape, you'll get charged for the whole thing. You'll get charged for the whole packages of bandages or gauzes or whatever. And that, of course, increases the hospital bill. Here, since we have our own hospital, which is Endo Hospital, and this hospital was designed around you, around our patients, around one procedure, which is the gastric sleeve, we have total control of this. So if you use one gauze, you get charged only for one gauze, and that saving is passed on to you, which is why we are able to get very competitive prices, a fraction of the cost in the United States, and of course, equal quality in the material used for your surgery, and really good outcome, way above other surgeons in the United States. So that is what we do. That is what we do for a living. That's what we do. I focus on one procedure. That's what we do every single day, several times a day, and we're able to pass those savings on to you. So talking about the term medical tourism, that goes over to well, the definition is actually patients coming from abroad looking for medical treatments. In this case, we focus only on gastric sleeve, only on weight loss surgery. But of course, medical tourism is a term applied to patients looking for open heart surgery, for knee replacements, hip replacements, for any other medical procedure that is expensive back home and they're looking for a better option abroad. And that's what we do. That's what we focus on. So we receive patients from all over the world. Our patients mainly come from the United States and Canada. Some from Europe. We have a good tendency now from Africa. And we fly in practically all our patients to San Antonio, Texas. We offer, we've got everything set up for our patients. We offer a door-to-door service. You don't have to worry about anything. All you have to do is worrying about getting yourself to San Antonio, Texas. We pick up from there and we take care of everything else. So we offer door-to-door transportation. We have a shuttle that picks up patients daily to San Antonio every single day, picks up patients, brings them down here. We have hotel here. We have a hospital stay here, surgical suites. Everything's included, medications, doctor's fees, everything, and we put it into one simple price. So you don't have to be worrying about getting a bill from your anesthesiologist, then a bill from your surgeon, and a bill from the hospital. It's very easy and convenient. You just get yourself down here to San Antonio, Texas. We pick you up. We take care of everything, door-to-door service, everything while you're here with us. And that is what we do. That is the term medical tourism. There are other countries that are very popular doing medical tourism. One is Mexico, of course. The other one is, well, Thailand is also very, very big. The other city, Turkey, I've seen Turkey is big as well. South America. But of course, being us, Mexico, right, as a neighbor to the United States, it's quite popular. Why here is because we are halfway. If you draw a line between the East Coast and the West Coast, we are right in the middle. So we can practically receive patients from the East and the West Coast toward the center, and the center is right there, San Antonio, Texas, and we're able to be accessible to our patients, to practically coast to coast from the United States. We do get quite a bit of patients from Canada as well, even though this procedure is practically free by the government in Canada. The only issue in Canada is there's quite a demand, because it's free, it's provided by the government, that the waiting list for this procedure is between 5 to 7 years. Most patients cannot wait that long. Some patients may even die because of their medical conditions trying to wait for this procedure. And these patients look abroad, Mexico, and we have quite a bit of Canadian patients as well. Canadian patients also fly into San Antonio, Texas, and we do the whole drill. So that is practically what we do. You might find other practices that may be similar or have a fraction of the services we offer. This is something that we've dealt with and worked with for over 10 years, 12 actually. And we try to get better. We try to make it easier on the patient. So the reason this facility, Endo Hospital, is built, having recovery rooms, having the hospital floor, having the surgical suites, having everything in one place under one roof. We've got transportation systems, we've got the spa, so patients on post-op are able to visit the spa for massages, facials, and everything. All this, of course, I didn't come up with it from the get-go. It's something that we learned throughout the years, and we're able to offer you the big advantage of having it all set up after 12 years. But that is the term medical tourism. It is not something new. It is something that I've been working in this field for quite a bit, and before me, it already existed. So patients looking for a good treatment, I almost forgot. In our facility, we also have ONSIV, which is our dentistry area, and of course, patients, while they're here, and their family members have access to the dentistry area for veneers, for implants, for a simple cleaning of your teeth, anything that a checkup. We have our dentists here in the same building to you have access to them. So before all this era, patients, since I was a kid in this town, I remember patients from abroad coming across from the U.S., searching for medical treatments, trying to save themselves some money. The idea is to save you some money, but of course safety is number one priority. We will not jeopardize or not the most minor thing to put you at risk with anything. Everything here is top-notch, medical equipment top-notch, medications top-notch. Everything has to be superb, equally or far superior than the treatment and things you would find back home. That is our goal, and of course pass on that saving on to you. So that is the term medical tourism. That is why Mexico, that is why where we are located, and the main reason of why we the way we work here. So I hope this helps. If you have any questions at all, you can always reach out to us via our website or any of our social media platforms. We're here for you, and we are more than happy to help you out with any questions that you may have on the way we work, on the services we provide, and of course, the better quality of life you may be searching for. I'm Dr. Alvarez, and thank you so much for another episode of Weight Loss with Dr. A.
If you're interested in knowing more about the gastric sleeve, visit endobariatric.com.